Every pregnancy is a matter of time, but some parents may wonder after 36 or 37 weeks, as they see what appears to be a fully formed newborn, isn't that long enough? For Iowa doctors and hospitals, the answer is be patient and wait.
The unspoken thing is that most of the pressure to deliver before 39 weeks comes from moms. And at that point in the pregnancy, most of them are very tired of being pregnant, their back hurts and everything is uncomfortable, and they want to be delivered.
Babies who maybe are born at 36 or 37 weeks, but they're the size of a full-term baby. So they think, well, my baby looks the right size, my baby should be doing well, but that baby is still a little early and may have a hard time feeding and may have glucose issues nonetheless.
Baby size, they would be 37 weeks. People would think 38 weeks, they think they would do fine. I will say some of my sickest babies with respiratory issues have been at 38 weeks, so it's very important for the baby to stay in where the environment is conducive to them growing and maturing, and then be delivered after 39 weeks.
In the past, convenience was enough of a reason for an early elective delivery. That is, any delivery that takes place before 39 weeks but is not medically necessary. But in Iowa, where doctors and hospitals are working through the Iowa Healthcare Collaborative and the National Partnership for Patients Initiative, such deliveries are beginning to disappear, and for good reasons.
In Iowa, we challenged every hospital to put a policy in place that says we will not deliver babies before 39 weeks. And in Iowa, every single hospital has that policy in place.
In fact, there are a number of serious issues that can complicate an unnecessary early delivery.
But with elective inductions, the risk that if we intervene to start labor, the risk that we most commonly see has to do with labor. There are longer labors, there are harder labors, and there's clearly evidence that there's more failed labors, meaning as hard as we can to get them in labor and to get them delivered vaginally, it doesn't work, and so there's higher risk of C-sections.
We often watch for or are concerned that they may have some of the same complications that premature babies have. So some of the more common ones I tend to see would be problems with breathing, babies breathing fast or needing extra respiratory support because their lungs just aren't quite mature yet. Problems with glucose stabilization, so they may suffer from low blood sugars, sometimes needing just extra feeding support, but occasionally needing IV therapy as well.
More complications such as temperature instability. They tend to not feed very well. They've got a higher chance of needing NICU services, and it can actually affect their academic development later in life.
The other things that are immature on a baby until they reach 39 to 40 weeks is their brain and their liver and their lungs. So if they're not mature, then they can have problems with feedings. With the liver, they can have more problems with jaundice than requiring treatment for that. And also respiratory issues, maybe would even need oxygen or need to be transferred to a higher level of care.
So I always tell parents that every baby is an individual, every baby matures differently, and really what we want to do is just optimize their gestation as long as possible so that they can come out as healthy as possible.
Through the Partnership for Patients, doctors and hospitals are counseling expectant parents, and in Iowa, early elective deliveries have been reduced by more than 95%.
Iowa hospitals have been great. They've really come together, really through the efforts of the Health Engagement Network in Iowa to work on developing policies within the hospital. So through their education of physicians, nurses, and patients, they've really all worked together to reduce the number of early elective deliveries that are happening throughout the state.
But I think it certainly is a good idea for groups like yourself to just say it's clearly recommended to not do elective deliveries before 39 weeks. And even with that kind of collaborative information, I think the docs in other locations can rely on that and say, well, the state collaborative organization says we shouldn't do it, and that's the reason we're not doing it, and it's clearly in mom and baby's best interest.
When we first did the survey, we found that only half of the hospitals had a policy in place, and our rate across our state was about 7.5% of these babies were born with an early elective delivery. When we put the policy in place and had all the hospitals put this in place, we've been continuing to track this on a monthly basis. Our goal was to reduce this in half. We now have over 9 months of data that shows that our rate has dropped to less than 1% of early elective deliveries.
So it's really an excellent thing that the Partnership for Patients campaign is teaming up with hospitals across the nation to try to put in place some policies and guidelines so that babies can have the best opportunity for maturity and that they can be born healthy and that they can go home with their parents.